Thank you for that introduction, Kathy, and thank you to APNA for having me. I feel like a bit of an imposter because I'm not a primary care nurse, but if I ever give up my career in renal, it's definitely where I'm coming next. So what I'm talking about today is My Kidneys, My Health, empowering people with early stage kidney disease. So what am I going to talk about? Well, I'm going to give you a little bit of a background about chronic kidney disease generally and some of the literature and a bit of a GP survey that we did. And part of the reason for that really is to explain why we think it's so important that we have books like My Kidneys, My Health for our patients. I'm going to talk about the consumer survey that we did that informed the My Kidneys, My Health book. And I'm also going to talk about the actual resource that we did and the phone app that we've now done as well as that. The aim of our project really was to develop consumer-driven resources that contain information, advice, support and recommendations for people who are newly diagnosed with chronic kidney disease. So, some facts about chronic kidney disease. It's definitely a growing problem. At the moment, population studies estimate that 1.7 million Australian adults have biomedical signs of chronic kidney disease. So that means either protein in their urine persistently or having a decreased EGFR. It's actually the 10th leading cause of death. And we also know that people who have chronic kidney disease have 2 to 3 times the risk of cardiovascular death. We know that early detection and optimal management can reduce progression by about 50%. And we know that now, but when I started in renal, I'm one of those people who put a lot of hours on that sheet this morning, or years on that sheet this morning as to how long I'd been around in nursing. When I started nursing, everybody thought you couldn't do anything about kidney disease. If you got it, you got it. Nowadays, we know we can slow progression by 50%. And we know that around 90% of those aged less than 45 that have hypertension don't know it. And given that 10% of our patients have high blood pressure, that's one of the interesting facts for us and something we're trying to do something about. When we were looking at doing this project, we discovered that there were no real resources in Australia for patients to inform them about chronic kidney disease and also how to self-manage their chronic kidney disease. Lots of just information, but nothing about self-management. So is a focus on self-knowledge and self-management important? We believe it is. We believe that patients need to move from what we'd call a passive stage with their health through to an activated stage with their health. So when people are in a passive stage, they have that sort of sense of isolation, helplessness, they exhibit passive behaviours, and they tend to put all their faith in their doctors and assume they know everything. But passive people can be given communication skills with materials that are health literate and with the health professionals actually listening to them about their personal situation. You end up with more of a partnership where people can get involved with decision making, self-care support, and they can become activated in their health care. So they can take action, find information and organise their questions and map their treatment options and choices. And we heard some of that from Heather this morning about some great examples of how they're doing that in the UK. But there is a bit of a problem in convincing people with chronic kidney disease to take action. And why? Well, early kidney disease tends to be asymptomatic. You can't tell that you've got it. People in this room could have it and not be aware of that fact, although I hope as primary healthcare workers you all do get your kidneys checked. It tends to get lost in the complexities of other chronic diseases such as heart disease and diabetes, which are bigger and brighter and more talked about. We always joke in kidney worlds that it's just not a sexy disease, so it's not always talked about or understood. There's a lack of knowledge by those who are diagnosed with CKD, and also health professionals might have limited knowledge or limited time. I think we're all time poor in the health world to spend with those who are newly diagnosed, so there is a bit of a problem. And this is just a quick diagram that shows how we see kidney disease. So the one little grey person in the middle is the 1 in 100 who has kidney disease and also knows that they have kidney disease. The 9 little red men are the ones who have kidney disease, could be at an early stage, but they're actually not aware of it. And then the rest of the population, in fact, 3 of those pale grey people are at risk. 1 in 3, should I say. So, health or healthy care needs to be 24 hours a day, and I think that's also been alluded to this morning. People, all of us, live with ourselves 24 hours a day and make choices about our health behaviours 24 hours a day, whereas we only see a health practitioner intermittently. We've already discussed some blocks, but the other blocks that we come across quite regularly are that people believe the long-term outcomes are not going to happen to them, so they won't be the one who ends up on dialysis or with a transplant. that there are lots of reasons not to follow the doctor's instructions, particularly if the benefits are not clear. Why would you? And we've all taken antibiotics or something and decided not to finish the course or made our own decisions about what we're going to do about our healthcare. And also, as we've mentioned, if you don't know you have it, then you can't manage it. And I quite like this little cartoon with the doctor trying to tell the patient what to do, but they really want to know what the second best option is because they don't like the first. So do people know they have kidney disease? I alluded to this. I'll just quickly show you the research about what happens with that. So the Australian Health Survey, that's a self-report survey that's done regularly by the government. Over at this far side, close to me, you can see awareness of having kidney disease, and it's down at 1%, whereas the red bar is the people that actually do have kidney disease, up at 10%. And the little bars down here used to it was like, 0.03% or something reported themselves as having CKD. At least now we're up to 1%. We're a bit excited about that, but we'd really like to get that up to 10%. And this is patients who explained why they'd been referred to a kidney specialist. So they'd gone to see a kidney specialist, and less than 30% of them said they were there because they had chronic kidney disease. So even people who are getting referred to a kidney specialist haven't caught on that they've got chronic kidney disease. They've got a number of other reasons why they think they're at the kidney specialist. So does having CKD affect health outcomes, and how long do people live? Well, this is 10-year mortality for people who have diabetes, and also those who have kidney disease. So if you have no kidney disease, you're basically looking at 4.1% mortality over 10 years. If you have albumin in your urine, you're looking at 17.8%. If you have an impaired GFR, you're looking at 23.9%. And if you have both albumin in your urine and an impaired eGFR, you're looking at 47%. So 1 in 2 people will die in 10 years. That's pretty high mortality. And this is something showing similar sort of data, but looking at the level of protein in the urine. The bottom blue line is those that have got greater than 300 milligrams per gram of protein showing up in their urine, and their mortality again is nearly 50%. And the less protein up to the red lines, the less mortality. Welcome everybody, we've got a few late arrivals. I knew this room was going to be the difficult one to get to after the break. CKD and cardiovascular risk. This graph's a little bit more complicated to look at, but basically, again, the same sort of thing. The people in the blue line who've got normal amounts of protein in their urine, when they have a normal eGFR, basically don't really have an increased risk of death, whereas those who have high levels of protein in their urine have a much higher risk of death, until you get down to the levels where your eGFR is 15, and basically everybody's on the same playing field by then. And as Heather mentioned this morning, economics are always important in everything that we do with health, even if we think we shouldn't take notice of them. And this is a lovely survey that was done to see how much people cost if they've got certain diagnosis in the health system. So it's total direct healthcare costs, as well as actual other government subsidies, which I presume are like pensions and those sort of things. So people who have no diabetes and no CKD are costing the health system $3,950 a year, direct or indirect costs. Once you add CKD diagnosis, you're up to $12,300 a year. Have a diabetes diagnosis rather than CKD, you've got $11,700 a year. Put the two together, people are costing $17,600 a year. And of note, this is not people on dialysis or transplant. They're costing the system about $100,000 per year for treatment. Does treatment of CKD have positive effects? Yes, it does, and I'm not going to go through this slide, but suffice to say at the top, the fuzzy green line is people who've got the most severe blood pressure levels, and basically they have the worst outcomes. And if they're treated with blood pressure tablets, that improves. With this one is also looking at ACE inhibitors, which are a commonly used group of drugs now with people with CKD, and shows again that people that take captopril, you can do great things to protect kidneys and the outcomes will be much better. And this is how quickly the kidney function deteriorates. So it's going to deteriorate much more slowly if people are using ACE inhibitors. And then this graph is showing similarly about whether people have strict glycemic control or not. So again, people who have intensive glycemic control, so good control of their diabetes, are going to have much better outcomes as far as their kidney disease goes compared to people who are just having conventional treatment. And sorry, I'm rushing a few of these because there was some confusion about how long I was talking for today. So what is the standard treatment and is it happening? The standard of care for CKD 1 to 4 in Australia is hypertension control, so to keep systolic blood pressures below 140. And I know this changes from time to time, but 130, 140 seems to be about the rough targets that seem to stay despite slight changes. Glycemic control, HbA1c less than 7%. Lipid control is shown to be effective in those with CKD. I know there's a lot of controversy about lipids control with statins nowadays, but it is effective for those with CKD. So we do recommend to use a statin. And then we recommend lifestyle measures, so healthy weight, exercise, good diet, no smoking, and alcohol in moderation. You'd be amazed how many people think alcohol actually damages the kidneys. It's about the only thing that doesn't seem to really damage the kidneys as long as you don't do it to excess. We did a quick survey to find out whether GPs were actually managing people appropriately, and we surveyed 4,000 GPs with a 16% response, and that was a paper-based or online survey. And we found that most GPs are practicing in accordance with current guidelines. So if they know the current guidelines and they know that patient's got CKD, then they are managing them how they're meant to be managed, which is fabulous. And we asked them for their top 3 things that they thought they should be doing for patients, and it was good to see that they thought blood pressure control, using medications was useful. Over 80% of them rated that in their top 3. Glycemic control was rated in, for 64% of them thought that was important. Avoidance of medications, adjustment of drug doses sort of cascading down. Interesting that lifestyle effects for reducing BP, they only saw as a 25% of them thought that was important. And we know you can control BP with some interventions. And just finishing off the sort of GP side of what we're doing in the space to help patients is the Chronic Kidney Disease Management in General Practice book that's available. And if you actually have a look on your table as well, you now have a DL for the CKD Go app, which is this book in an app that you can use for patients or the GPs can use for patients. And our primary care team who produced that also do education for both primary care nurses and for GPs. And that's just some screenshots from the app. So the app's really good, and it's free from the App Store, so feel free to download it if you've got space on your phone. So this project, as we said, the aim was to develop a consumer-driven resource, and we've discussed this, informed by those with CKD, information and support to empower people, good health literacy, could improve health outcomes, and was evidence-based. First of all, we had to determine what content we were going to do, and what we did for our survey was had an advisory group that represented multiple disciplines and consumers. We had a look at all the published literature around in this area and some feedback from some other Kidney Health Australia programs, and we designed a 14-item online or paper-based questionnaire, which we promoted to kidney consumers over a couple of months through our usual channels. We managed to get a wide range of ages responding to our survey, and we also got a wide range of states, although nobody from the ACT or the NT chose to give us an answer, and Victoria were particularly excitable. Most of the people who responded had actually had kidney disease for more than 2 years. What we found when we asked them what they wanted was they wanted information about how to stop the progression of the chronic kidney disease. They wanted information about how to self-manage, knowledge regarding their treatment options, so what could they do? What about diet and lifestyle? What is CKD? What is chronic kidney disease? And who are the support groups? And we found they were least interested in tools to record their medications or manage their conditions. Having said that, we asked them to score everything out of 4. It was a Likert scale from 1 to 4. And up at 3.5 is advice on how to stop CKD from getting worse. So they were pretty keen on most stuff, and down at sort of 2.9 is the tools and charts to support things. So they wanted a wide range. And how did they want the information? We asked them to pick their top 3. We're in an era where we need both paper information and electronic information for everything we do, because there's many people are using both. And that was pretty much shown from the results that we got. The only thing people didn't want was DVD or a video, so we wrote that off the project immediately. Would you like a phone app? 75% said yes. So that got into the project. And some qualitative insights. Approximately half recalled receiving little or no information at the time of diagnosis. We do know it was over 2 years since most of them had been diagnosed, but they still didn't recall getting any information. And there was a disconnect between the information they received and their fears and concerns. So what action did we take to meet their needs? We had a one-day meeting with the results of the survey and further consultation with the advisory group, developed 5 key messages, the handbook, the smartphone app, and some website content, and we stayed in touch with this advisory group. Our key messages were very consumer informed. You are not alone, you can slow the damage, easy to get your kidneys checked, blood pressure tablets protect the kidneys, and your healthcare team are there to support you. And those were the messages our consumers wanted in that book. We had a bit of a debate about the title. We came up with My Kidneys, My Health, and that was because we felt that this was more active language that was saying to people, these are your kidneys, it's your responsibility to look after them as you move forward. You obviously partner with your primary care team, but it's your responsibility. And this was the book we ended up with, or this was the cover. This is the book that we actually have. So it has personal stories in it. We've got 4 personal stories. It has calls to action, things you should do. Go and get your kidneys checked every year. Many resources listed, diabetes, NPS, all sorts of people that we thought were useful. Lots of images. The language meets grades 7 to 8. We had that tested, and it targets CKD stages 2 to 4. We've got nice, colourful, bright index and colour-coded. Joy's one of our delightful people who's not only on our committee but shared our story and gave us lots of insight. And we have lots of images to explain the different things that we talk about. So this is just showing the kidneys getting smaller, that sort of visual image of them getting worse over time. The detect section talks about healthy kidneys, kidneys that are not working properly, when to get screening, what's chronic kidney disease, what's acute kidney injury, and links between kidney and heart health. And that's just a nice little diagram explaining the testing you need to do. The prevent section talks a lot about healthy lifestyle. Most of this book talks about healthy lifestyle and support and those sort of things. So blood pressure targets, your diabetes and medications. And then we have a support section which talks about mainly connecting with KHA, but other supports that are out there, gives them lots of resources, talks about carers, also defines a few of the people in their healthcare teams and all of our different supports. We're nearly there. And then we have now put that into a phone app, so it has all the same content, interactive sections, and direct links to all the support materials and resources. And we can also, from our organisation, do push messaging, so we can send people a message to say, hey, it's time you got your kidneys checked again. There's been a lot of research proving that's effective. And I've put that it'll be free download from the App Store from next week, but I actually believe it's gone live today, and Brini was going to check and see whether it was or not. And those are some images of the phone app. So our next step, we're going to do a survey of consumers using the book, lots of advertising. We have DLs by the millions, so you can contact our office and you can have lots of DLs for your surgery. We're converting the apps to Android, and we're developing a follow-up service for those who contact us to see if we can help them with any other information. So people diagnosed with CKD desire information covering a diverse range of topics, and we used a collaborative approach to develop a new book and a phone app. The book can be downloaded at www.kidney.org.au from our support newly diagnosed section, or we prefer that patients that want it call us on the free call number and they get a free copy mailed to them, and then they've also hopefully got connection with Kidney Health Australia. And that's just my acknowledgements. Thank you.